Can birth control cause urinary tract infections? Have you ever wondered if your birth control could be affecting your risk of urinary tract infections? This is a common concern, and the answer is a bit nuanced. Certain types of birth control can influence the likelihood of urinary tract infections, but it really depends on the method you are using. Let's break it down. Oral contraceptive pills, which many women use, do not directly increase the risk of urinary tract infections. Studies and health authorities have found no strong evidence linking birth control pills to a higher incidence of urinary tract infections. If some women using these pills experience more infections, it may be related to other factors, like increased sexual activity. Sexual intercourse can introduce bacteria into the urinary tract, which is a known risk factor for urinary tract infections. On the other hand, some non-oral contraceptive methods, particularly barrier methods such as diaphragms and spermicides, have been associated with a higher risk of urinary tract infections. Diaphragms can put pressure on the urethra, which may prevent complete bladder emptying. This can create an environment where bacteria can grow. Spermicides can disrupt the natural balance of good bacteria in the vagina, allowing harmful bacteria to thrive, which can also increase susceptibility to urinary tract infections. Recent research has suggested that hormonal contraception, in general, might be linked to a higher prevalence of recurrent urinary tract infections in women under 40. This may be due to hormonal effects on estrogen levels or patterns of sexual activity. However, it is important to note that this association is still being studied, and more research is needed to understand the relationship fully. In summary, oral contraceptive pills do not have a direct link to urinary tract infections. However, barrier methods like diaphragms and spermicides may increase the risk due to mechanical pressure and changes in vaginal flora. Some studies suggest a possible connection between hormonal contraception and recurrent urinary tract infections, but the evidence is not definitive. For those concerned about bladder health, it is crucial to recognize that urinary tract infections can affect bladder function and lead to complications if they are recurrent or untreated. If you are using any form of birth control and frequently experience urinary tract infections, it is a good idea to discuss alternative contraception options and preventive strategies with your healthcare provider. Maintaining good hygiene, urinating after intercourse, and ensuring you fully empty your bladder can help reduce the risk of urinary tract infections, regardless of the contraceptive method you choose. Understanding how your contraceptive choices may affect your urinary tract health is essential for making informed decisions that support your overall well-being. Always consult a healthcare professional for personalized advice tailored to your health needs.